Good evening, everyone. My name is Matt, and today we will be talking about improving patient satisfaction in the urgent care setting. So for my nursing practicum project, I'll be exploring potential ways to improve patient satisfaction ratings and submitting this research to my Director of Nursing Services so that we can potentially make some changes to improve these patient experiences. My learning contract objectives included identifying common complaints, reviewing of literature, analyzing those reports, doing an annotated bibliography, listing potential strategies to improve these ratings, developing and submitting a protocol, and staff education, of course. So the most common complaint, of course, when in the urgent care was wait times. So often a patient will come in and they'll complain about having to wait in the room for, often 30 minutes without, being seen. And there can be multiple factors that contribute to this, staffing, or, a patient comes in with difficulty breathing. This needs to be addressed immediately. Or, sometimes patient visits just take longer than expected. So some patients left the center unsatisfied because they came in for something that we were unable to accommodate their needs for, or they were referred elsewhere. If someone comes in with a really bad concussion and they need CT or other imaging, they were referred to the emergency department. Someone comes in, needs to be ruled out for DVT, they need to go to like one of the imaging places in the area. Or if someone needs pre-op clearance, I mean, they're asking one of our physicians to sign off that they are a low risk for surgery after having only met this person for 30 to 45 minutes, and we're going off of limited information. And there is no report developed there. So this is a safety issue. So these patients were referred back to their primary care provider. One complaint was received was a delay in response from the providers when requesting prescription changes. So this is typically addressed between patients, and when you have a high surge, you have a surge of patients come in. It can often be a couple hours before this request is approved or denied. Many patients verbalize that during the wait time, after they've been triaged, roamed, they'll wait for 30 minutes to an hour in some cases, with little to no interaction with staff members or update as to what's going on. Come in for a complaint of a sore throat, 45 minutes later, they haven't even been told that they tested positive for strep. And this is something that definitely needs to be addressed. So some patients did complain about the EHR and lack of compatibility with other systems, and someone did complain about not having baby changing stations in the restrooms in the waiting room. So having the opportunity, got the chance to speak with my medical director and director of nursing services, as well as my project mentor, and we did a little bit of brainstorming to potentially find some solutions to these problems. And one that was mentioned by the medical director was a check-in system where a patient receives a text once their positioning queue is up. And due to the limited time frame that we were working, this was, kind of impractical. I mean, we also would have to push this up through corporate, wait for approval. There's the cost of the implementation, and you also have the potential for a HIPAA violation, as well as prolonging wait times, because if a patient sees they have 8 people ahead of them, I'm going to go next door, go get some food. Next thing you know, you're hunting down a patient, and you could have easily seen 2 or 3 people in that time frame. Let's see, providing patients with more frequent updates. You see that they've been waiting in the room for 30 minutes, and they're kind of looking a little agitated. You walk in and say, "Hey, is there anything I can help you with? The provider's in with someone. You're up next. Is there anything I can get you to make your stay a little bit more comfortable?" And setting realistic expectations would definitely go a long way. If we provide accurate information about the capabilities of the facility and potential delays, we can help tailor these expectations and improve their perceptions of staff members as well as the organization. So I was able to collaborate with my project mentor on multiple occasions, and Mr. John Gino, nurse practitioner, provided me with a lot of guidance throughout this project. The main one, of course, was narrowing the scope of the project. Matt, you're setting these goals. They're too spread out. You need to narrow your focus, and this helped me hone down on my project where I wasn't bringing a huge amount of information, and it's all over the board you know, without being able to address one specific topic. And he made himself available at many opportunities. He said, "Hey, if you need anything, send me a text, call, email, whatever you need, just get in touch with me." And every day I'd work a shift with him. He's like, "Hey, man, how's your project coming? Is there anything I can help you with?" So he was useful the entire duration of the project. So the proposed solution to the concern with patients having long times without any information, uh, was on days with high volume of patients and extended wait times, no status updates, to just pop in every now and then, make a presence. Out of all the factors that contribute to dissatisfaction, this is one of the most easily modifiable ones. This just takes glancing at the screen, seeing that, okay, this patient's been in evaluation status for 20 minutes and hasn't been seen. Let me go, get a set of eyes on them. So staff education was done informally, predominantly during break times, or if we had low patient volume. So just sitting around chatting. So while wait times are not as easily a modifiable factor, we can help manage these expectations by providing constant updates. If something comes up that may take a prolonged amount of the provider's time, go in, say, "I know we told you that you were up to be seen next after he's finished with this patient. An emergency came up that needs immediate attention. My apologies for any inconvenience. Is there anything I can get you in the meantime?" That little bit right there goes a long way to, you're helping to meet the needs of the person, and you're managing those expectations at the same time, as well as making a presence, so they don't feel that they forgot about me. What's going on here. And you're also protecting the confidentiality of other patients by, not giving them all of the details. We also talked a little bit about the halo effect and how one initial impression can influence all other opinions about an area. So someone comes into the center and they check in. While they're registering, they end up arguing about insurance with one of the receptionists. That will alter a patient's perception of the entire facility for the rest of that visit. I mean, if someone comes in and they've been triaged, they get put in a room, they look over and the first thing they see is one of the nurses sitting there on her phone, texting. Their perceptions of the facility go down right there. So that's one that can easily be altered. For my survey, I had the opportunity to speak with 26 patients about their experience, and this speaking with the patients directly was more of a practical approach than actually having them fill out survey cards and such. As a this can be done while I'm in the middle of bandaging an area, or putting an ace bandage on, or doing a dressing change, something like that. And this took place. What was it? 26 patients were surveyed, and our median visit time total was 39.9 minutes. And our staffing was one physician, one nurse practitioner, one physician's assistant, two registered nurses, two medical assistants, one lab tech, one x-ray tech, and two patient service representatives. So we were optimally staffed for this type of situation. And if we would have been short a provider, it definitely would have prolonged the wait times a little bit more, and that would have definitely had an impact on on the patient's wait times overall. The limitations of the survey were a small sample size, the short duration of the study, and the staffing at the facility during the shifts. Thank you so much for your time. Have a great day.